And when you have a situation where there are shades of gray, you have to admit it.
Let's get some callers back engaged in our conversation who would like to pose their questions about Lyme disease and how best to treat it. Dave in Corte Madera joins us next. Dave, go ahead.
Hi. I was bitten by a tick about 3 months ago, and I went to my doctor. I never got the rash, and I have had a few symptoms. I've had some headaches and a little achy, but I'm 42, and sometimes you just get a little achy. Anyway, my doctor suggested I get a titer test. I haven't heard you say anything about a titer test. I haven't had a chance to go to the lab yet to get the blood work done, but I wanted to hear your comments on how effective that is at diagnosing Lyme disease, or what I can do just to, assure myself or feel comfortable that I haven't contracted it.
Dave, thanks for the call and question. Pam Weintraub, do you know about that particular test?
I think that your doctor is probably talking about an Lyme ELISA test followed by a Western blot. And these tests are very problematic because in the first stage, which is considered a screening test, many patients that would actually pass the second stage, the Western blot, fail. So you're missing a lot of patients in that first test, and then in the second test, the Western blot, it's problematic because, of course, if you have the 5 of 10 bands designated by the CDC, then you've got great evidence for Lyme disease. But there are Lyme patients that don't pass that test for another number of reasons, including the fact that some strains of the spirochete lack some of the antibody bands that are required in that test, and because there are 100 strains in the U.S., there are some scientists, like for instance at Stony Brook, who are looking for much more sophisticated 21st century technologies to give us answers as to diagnosis. So you can get the test, and if you're positive, then you have very good evidence. But if you're negative, it doesn't really, in my opinion, mean that you don't have Lyme disease.
Rob writes in this email, I'm interested in your guest comments on the New England Journal of Medicine studies from 2001 showing no benefit of 90 days of antimicrobial therapy in over 100 patients with chronic Lyme disease. That's one of the studies that is often cited in this, the study from the New England Journal. What's your view on that, Kris Newby?
I think isn't that the
that's
Klempner study?
No, that's Steer's study. And that study is very problematic, like all of the other studies that hew to this very narrow definition of Lyme disease in the first place. So if you have a very restrictive definition and you apply it to these people, then obviously only a very restrictive number of people are going to pass your test. I do want to add one thing, that Johns Hopkins recently did a study on the two-tier Lyme disease tests. They found that about 75% of the people, one way or another, didn't pass those Lyme disease tests. So
the test is very bad.
So you have to cast a skeptical eye on all of those studies.
I want to keep us moving along here and get in as many calls as we can, but briefly, Dr. Shapiro, on this question, it does seem like that's a problem. If the restrictiveness of how you are diagnosed is so small, almost by definition, you're not going to be able to widen that out so that people are going to show positive effects from treatment.
Well, first of all, the patients that have false negative tests on those it's well recognized. It's because the rash occurs before you develop antibodies. So the vast majority of patients who are negative, even though they have Lyme disease, in fact, have the rash, and it's early Lyme disease. These studies studied patients with late Lyme disease. 100% of patients with Lyme arthritis will have antibodies because it takes 3 or 4 weeks for the antibodies to develop, whereas the rash develops 10, 14, 20 days after the bite. So that's part of the problem. But, certainly we can use better tests, but I would disagree. The other point is that there is no definition of chronic Lyme disease according to the Lyme literate doctors. The definition of chronic Lyme disease is I say you have chronic Lyme disease. I would be very interested in a definition. One of the problems with studying chronic Lyme disease, frankly, is that even the Lyme literate, so-called Lyme literate doctors don't have a definition other than the fact that they say it's Lyme disease. So as a scientist, I think we need to try to, I'm all for getting the right answer. If there were scientific evidence that long-term antibiotics provided more benefit than harm, I would jump right on the bandwagon.
Is there that evidence? Is there that evidence, Pam Weintraub?
Absolutely not.
I'm delighted to hear Dr. Shapiro say that he would like to have more evidence, because I would also like to see much more research. There is no question but that patients who have chronic Lyme disease or who have persistent symptoms of Lyme disease after the standard treatment, and I'm just going to throw that out there as my own personal working definition, that many of them are not cured by long-term antibiotics. The fact is that we do need more research, and we do need other treatments. They may be antibiotic treatments, or they may not be antibiotic treatments. They may be immune treatments. But we do need to get to the bottom of this, because these people are sick, and we need the research for that.
Back to our callers. Grant in San Francisco joins us next. Grant, go ahead.
Thank you very much. I would like your guests and your authors to discuss the challenge that is presented when someone doesn't know they have a kind of Lyme disease or spirochetal infection. They begin to get depressed. They see a psychiatrist. The psychiatrist gives them anti-anxiety drugs, depression drugs, ADD drugs, and then lo and behold, 4, 3, 5, 6 years later, they realize they have Lyme disease. And it creates this scenario where it's very easy for the primary care physician to deduce that they're suffering from some sort of delusional syndrome. And I am working on a book about this, and I've come across this a lot. It's very easy to just discount the patient as the film says in its tagline, it's all in your head.
Grant, thanks. Thanks for the call and observation. Comments or thoughts, Kris Newby?
Well, it was really interesting. The first time we started filming Lyme patients, we were at a Lyme conference back east, and for 2 days we listened to over 60 Lyme patients. And the thing that was really shocking was almost all of those 60 people had been accused of having psychological problems. So at that point we knew we had a really interesting film. Also, most of them had considered suicide at one time or another because the symptoms are so horrible. I think it's all about information. I think the well of scientific information on Lyme disease has been poisoned by conflicts of interest by this small group of academic researchers, and we need to open it up, have the equivalent of a Manhattan Project to think outside of the box and just get the dialogue going now. I mean, a problem with it now is we have a he said, she said, really polarized scientific discussion, we don't have a discussion. Nobody's talking. So we need to have conferences that bring the clinicians together with the researchers, and we need to really get better information about what chronic Lyme is.
On that one point, I'm sure all of us would agree, including Dr. Shapiro, who has joined us for the second part of this program, and I do appreciate your calling in. Lots of people calling in with real everyday questions. How can you avoid it? What sprays do you recommend? Is it common in the cities? What part of the country can I get it? Is it true here in California? So forth and so on. Don't have time, unfortunately, to go through them all. But where's the best place to get information in such an amorphous condition with so many possible symptoms? Just to get the best information available, where would you point people to, Pam Weintraub?
Well, I would say that in the beginning, when you think you have a disease, it is really good to start with the mainstream. But if you are cast from doctor to doctor, you get sicker and sicker, and nobody has an answer for you, and you're slowly losing your life, your job, your ability to function, and you believe you have been exposed to tick-borne disease, then it behooves you have no choice but to cross the line and see a Lyme literate doctor who deals with these patients. And that is where you should go.
You can start. There are a lot of really good resources on the Internet. And I would go to Turn the Corner Foundation, Lyme Disease Association, and LymeNet, and start there. And
Dr. Shapiro, best place for information in your judgment? Dr. Shapiro? Guess we lost him.
American Lyme Disease Foundation, ALDF.org, I believe, or the CDC.gov will have information.
Okay, thanks. Thanks for calling in. Appreciate your participation, Dr. Shapiro. Thanks, too, to Pam Weintraub, again, her new book is called Cure Unknown Inside the Lyme Epidemic. Cure Unknown Inside the Lyme Epidemic. And Kris Newby, whose film is called Under Our Skin. Film available to see, Kris? How, if someone wasn't able to get to the local film festivals, where can it still be seen?
So there are many community screenings all across the United States being held. You can go to underourskin.com or you can purchase the DVD.
All right, Kris Newby, thanks very much for being part of our program today. Forum is produced by Kevin Guillory and Judy Campbell. Our senior editor is Dan Zoll. Our engineer this hour, Danny Bringer, and the executive producer of Forum is Raul Ramirez. I'm Dave Iverson, and this is Forum on KQED.